this week's Cardiology Countdown, we have several papers looking at management of risk factors, but at the number 3 spot, we have a national survey that has looked at the trends in revascularization over the past decade from 2001 to 2008. There were data collected from in-hospital practice within the Healthcare Cost and Utilization Project that found overall a 15% decrease in the number of CABGs performed, but a steady rate in the use of PCI. I suppose this tracks very nicely with our overall practice patterns, where Revasc has been shifting from CABG to PCI and perhaps some reduction in CABG overall. But I think evidence that greater medical therapy may be contributing to a lower need for revascularization. At the number 2 spot, we have a very interesting paper in Circulation that looked at the novel and not yet approved in the United States approach of doing bilateral renal artery denervation. And this is a procedure targeting resistant hypertension. There was some data at last year's AHA on this. This is a study of about 50 patients, 2/3 of whom got the bilateral catheter ablation and 13 control patients. They saw a very striking reduction in blood pressure, about 30-point systolic and 10-point diastolic reduction in blood pressure. But this paper focused on improvements in insulin resistance and cardiometabolic changes. And so they found that glucose fell from 118 to 108, a highly significant difference. Insulin levels and C-peptide levels all decreased over just a 1 to 3 month time period. And so this uncovers really a novel interplay between hypertension and cardiometabolic derangements and suggests an additional benefit of this novel procedure as it moves along in testing. At this week's number 1 spot is a very nicely done meta-analysis looking at the beneficial impact of exercise on diabetes. And they looked at overall 47 randomized controlled trials of exercise of different types on glycemic control using hemoglobin A1C as the metric. And this is a continuous measure. It was very powerful to look at a total of 8,500 patients in these 47 studies. Interestingly, they found that a structured exercise program involving either aerobic or resistance training led to significant reductions of about 0.7 and 0.6% on the hemoglobin A1C, and the combination of both also had a significant reduction, 0.5, in the overall analysis. Now, interestingly, when they broke it out by time, they found that those programs of greater than 150 minutes had a greater 0.9% reduction in hemoglobin A1C as opposed to those of less than 150 minutes, and there it was just 0.36%. And so that is very supportive of the current ACC-AHA guidelines recommending 30 minutes a day of exercise, ideally every day, but a minimum of 5 days a week, and hence 150 minutes of exercise. And so just getting advice to do this was also seen to be effective if done in combination with dietary advice as opposed to these structured programs. But I think reaffirms for all of us the benefit for ourselves and our patients to do regular exercise of about a half hour a day for 5 days a week. So with this week's Cardiology Countdown, I'm Chris Cannon.